Welcome back, and thanks for watching the last segment, Clinical Outcomes using E4D. In this segment, we're going to look at the return on investment possible with the E4D system. Now, in my practice, I have seen a 20% increase in my efficiency using E4D versus the laboratory fabricated method. But in order to be more conservative, we're going to assume that our laboratory procedure time is the same as that of the E4D procedure. This leaves us with the same general office overhead using E4D versus sending something out to a lab, and only a couple of special overhead factors to consider. For the laboratory fabricated method, we're going to do a temporary and we're going to make an impression. And the cost of doing this is around $40. We're also going to have a lab bill, and the average cost for a ceramic restoration is around $150. Now, for the E4D system, we have some materials cost as well. We have a block, we have burrs, and we have lubricant. And the cost of these three items is around $40, or the same as that of the impression and the temporary. We also have the acquisition cost for the unit itself. Most dentists choose to pay for their system over a 5-year period at a rate of $2,400 per month. And we're going to depreciate that equipment over that period of time and realize a tax savings of around $650 per month. That leaves us with a net investment per month of $1,750. So in order to determine our break-even point, we simply divide $1,750 by our lab bill of $150, and we can see that when we do 11 or more restorations with the E4D system, we've passed our break-even point and we become more profitable. In fact, at 12 restorations or more, we're going to realize an increase in profit of $150 per restoration. This equates to an additional $1,200 per month in profit if we do 20 restorations per month, or $2,700 additional profit if we do 30 restorations per month, assuming that we are not more efficient with E4D. Now, if you're like me and you do realize an increase in efficiency, obviously your profit is going to go up further. But there's another factor to consider. It's control. If I send a restoration out to the lab and I have to ask that patient to come back, then I run the risk of having that patient fail the second visit. I also run the risk of the temporary coming off and having a non-productive procedure time in order to re-cement the temporary. Those losses of control are not an issue whenever we do these restorations in one visit using E4D. This, of course, also increases our efficiency and our profitability. Now, I've given you my experience using E4D. Learn from your own experience. Take the survey, request a custom ROI, and use your numbers to learn what the profit potential is for your practice. In the next video, we're going to look at the power of E4D as it relates to attracting and retaining patients in our practice.